Hey everybody, Roger Perrigo here at Perrigo Chiropractic. I just wanted to take a minute to talk to you guys today about headaches, and specifically what are called cervicogenic headaches. Now, what those are headaches that are caused by issues in that neck and upper back. I see a lot of patients with these headaches and the neck pain that a lot of times will come along with it. And chiropractic can be really helpful for that. Dry needling can be really helpful for all that. Of course, there's other modalities, things that can be helpful too, home exercise program. But in a lot of cases, they are caused by trigger points in that neck and upper back area. If you're unfamiliar with trigger points, basically what they are is little knots in the muscles, and in this specifically today, what we're talking about in that neck and upper back area. And kind of angry muscle fibers that are just real tender when you push into that area, and sometimes it almost feel like a little marble or something in the muscle because those fibers just don't relax when they should. Today I'm going to go over what you can do on your own to help relax those things and hopefully help with those headaches that may be going on. There's a couple of muscles that I like to focus on when you're addressing those headaches. The first one here is called your SCM. And what that does is it starts at the sternum and the clavicles, and then it's the big muscle. If you kind of tilt your head to the side, it's the big muscle in the neck that you should feel attached right behind the ear at what's called your mastoid process. And then the other one that I like to focus on too, now there are other muscles too that you can work with, but these are two big ones. But the other one that I'm going to talk about today would be the upper trapezius, so the muscle right here, the big muscle in that upper back that goes up into that neck as well. To treat these trigger points on your own, what you can do, so you can see here, the trigger points along that muscle, the SCM muscle. When you're having these headaches, you're going to have sometimes the headache will start at the base of the skull, and then you'll feel it kind of radiate around to the eye. So what you can do to treat those trigger points, though, you're going to feel along the muscle until you find one of those areas where it's really tender to push. And in a lot of cases, when you push in them, you'll actually feel that headache kind of recreate. So you're just going to gently press into those tender areas, just nice and easy, just kind of push in there until that initial tenderness starts to relax. And you can kind of rub on it a little bit too if you want to. And then once that tenderness relaxes, you're going to push a little bit harder. Until that secondary tenderness starts to relax a bit too. And so as you get that to kind of go away, a lot of times you'll start to feel that muscle relax in itself. And then you'll just move farther up the muscle, say, you get up closer to the skull, and you're going to press gently there as well, and do the same thing. You're just going to repeat that. You're just going to press in until it relaxes, until the tenderness goes away, and then you press a little harder until that tenderness goes away. So you can do that in that SCM. And then you can do that in the trap as well. And a good way to find the trigger points in that trap is to start halfway between the outside of the shoulder and the neck, right? So you're just going to kind of start right in the middle of that muscle until you find that sore, that trigger point area. You're going to hit that and do the exact same thing. You're just going to push into that until the tenderness stops, and you're going to push harder until that tenderness relaxes. And you can work your way up the neck with that one as well. As you get those trigger points to relax, like I said, as you're doing that, initially you may actually feel that headache recreate, but then as you get those to relax, that should help keep you from having those headaches further on, hopefully keep you from taking headache medication, things like that. So give those a try, see what you think. And if you're curious about how chiropractic can be helpful, maybe dry needling or some other treatments that we can offer, give me a call at 402-627-8294. I'd be happy to talk to you about it. Or if you want to schedule an appointment, you can either give me a call or go online and book online at perrigochiro.com. I hope you have a great day, and we'll talk to you soon.